The number one health concern for older men, prostate cancer. The American Cancer Society says 218,000 new cases of prostate cancer are diagnosed every year, with some 3,200 men dying from the disease. New research has revealed a common vitamin that can significantly lower the risks of prostate cancer. Natural health expert Mark Mincolla is here to talk more about the fascinating findings. And before we get into that, Mark, what are the numbers showing in terms of diagnosis for prostate cancer within the last year?
Well, just in the past year, the biggest leap since the mid-90s. A 13% increase in diagnosis, 17% increase in mortality, just over 1 year.
I think it's a case of whether they're doing better testing here, or that actually there's more prevalent, prostate cancer is more prevalent in there.
A lot of folks do argue that the testing is more extensive and more efficient, but I think that also you look back over the past 20 years, there are leaps that just seem to be kind of unexplainable.
Let's talk about who's most at risk here when it comes to prostate cancer.
Well, 40-year-olds are encouraged to be screened every year. There are 30 million screenings, and men over 50 really are the ones that have to be most concerned about risk. Men over 65 represent 2/3 of all those diagnosed.
And when you talk about getting screened, what type of test we're talking about?
Well, of course, the PSA, the prostate-specific antigen, which is really, really an important test. But, you know, there's a great debate about the PSA because it's effective at only a 3.8% rate. A lot of folks say the digital is really important. There's a new PCA antigen test, a PCA3, not yet FDA approved, expected to be approved soon, very efficient.
And while the digital rectal exam scares off guys, it's an important thing to have. And the PSA is simple, it's a blood test, so they're very simple things.
Well, and the key gene is early screening is really important.
Now, let's talk about this study. What exactly was done here? What was the basis of the study, and what were the findings, the results?
Well, National Cancer Institute, National Institute of Health, New York University combined in a cohort of 300,000 men observed over 5 years. Those men who had at least 800 units of vitamin E a day supplemented or greater versus those men who didn't supplement had a 32% reduced risk of being diagnosed.
So this is a massive study here.
Yeah, massive study, and we're talking about 1/3 reduced risk.
Now, when you talk about the supplements, what foods can you get vitamin E from, and can you get enough of vitamin E from the foods alone?
Well, that's a great question, too. Florida Atlantic University, as recently as last June, found that there was a similar kind of number that came up when they studied men who consumed the nuts, the foods that were high in vitamin E, like the nuts, wheat germ products, whole grain products, vegetable oils. Again, a reduced rate there as well.
So, what you would recommend for men then would be what? Not only increase your diet in these foods, but go ahead and take the supplements too?
No question. In fact, there are the specific studies that say there's a type of vitamin E called gamma, G-A-M-M-A, that seems to be really a breakthrough vitamin as far as this research goes.
And to make sure you're getting the 800 milligrams, I mean, can you look at your food products and figure out how much you are getting from a particular food item?
You know, there's a different comparison there. I think, you know, you're getting more of a sort of effective value from the standpoint of intrinsic. You know, food has an intrinsic value. In much lower doses, it's equally effective. So you're going to get 30, maybe 40 milligrams for a serving of food that has high vitamin E, as opposed to 800 units that you'd get in a supplement. So I think the idea of supplementing with gamma E plus having a diet that's rich in good, healthy vegetable oils, nuts and seeds, whole grain products as opposed to white flour products, way to go.
The combination there's a smart move.
Absolutely.
What about guys that hear this study and they say, I'm going to do whatever I can, and they start really loading up on the vitamin E? Can you overdo it?
Well, of course you can. I mean, it's a fat-soluble vitamin, which means it does collect in the body. So it's a great antioxidant, very important free radical scavenger that helps neutralize those bad free radicals that increase the risk of cancer. But it is fat-soluble, builds up in the liver, and too much is not a good thing. So there are a lot of folks that got to be careful about doing those really high volumes.
And is this something you suggest someone can do on their own, or do you need to really balance this out with your doctor in terms of how to best supplement?
It's always good to sit down and strategically do a powwow here and to get it right with your healthcare professionals. But I think that there's certainly a lot of great information out there these days. It's been published, a lot of great books and self-help books. There's good information that would guide us to that sort of proper usage, but I think it's pretty easy to do, always good to coordinate.
Right, and we can't stress enough, guys, get yourselves screened.
Absolutely.
It's very simple, and you'll be glad you did, and then once you get screened, you have that baseline, and then you can go from there as you get older.
Every
Absolutely.
year.
All right, Dr. Mark Mincolla, thank you, and also you can find out more from Dr. Mincolla at his website, maxhealing.com. It's always great to talk with you.
Thanks, Gene.
All right, let's send over to Kim.